Welcome back. October marks Spine Awareness Month and helping address the importance of spine health and also why spinal health is so crucial. We have a special guest here with us to tell us that.
We do. Very special is Dr. Jon Dean. He's a chiropractor and founder of Oakland Lifestyle Medicine. Thanks for dropping by this morning.
Thanks for having me.
So overall, why is spinal health so important? Give us a high-level answer to that.
Sure. So the short answer is you only have one spine, and you have it for the rest of your life. Spine's pretty important. It connects your brain to the rest of your body. If that is not functioning correctly, your brain can't get the proper signal to the rest of your body. So a lot of things can go wrong if your spine isn't working for you.
Is that why mom always says sit up straight?
Hopefully, yeah. And hopefully most parents are still talking to their kids about having good posture because it's really important.
Yeah, I know. I've been getting hounded about that my whole life. So give a few quick tips to help people maintain posture at home or at work when you're sitting down all day.
Sure. The biggest #1 tip that I tell most people is to stand more. You know, we've become such a sedentary country, lifestyles that we have nowadays with the way we work. We sit constantly. Human body is not designed to do that. It's designed to stand and walk. So the best thing that you can do is get a standing desk. Make sure that you're standing more at work. If you don't have access to a standing desk, you want to at least be taking breaks every 30 to 60 minutes. Stand, walk around, move more. It's the best thing you can do for your body.
And there are some stretches, right, and some exercises that actually really hone in on that,
Absolutely. Right? Yeah, and especially if you're starting to notice things like stiffness in your neck or your low back, especially in the morning. We shouldn't have stiffness upon rising. You know, stiffness should more be after activity where those muscles have been working. So if you're starting to get that stiffness in the morning, you really do want to incorporate some type of good stretching routine. The easiest ones to do are simple knee to chest stretches, laying on your back, bringing one knee to the chest, then the other, then both knees to the chest. Yoga in general is a phenomenal thing to do for your spine and general health, so always incorporate good yoga poses as well.
Well, look, you're on the
There
yoga.
you
That's
go.
good. See,
I didn't even know.
I'm a big stretcher. When I watch TV, I do those knee to, chest stretches, and it feels so good. It definitely does. Now, you mentioned if you wake up in the morning and you're stiff, something's not right. So when should somebody actually consider seeing a chiropractor?
Sure. So the first warning sign is going to be that stiffness. Stiffness after some activity is relatively normal. You know, if you go for a run and your back tightens up a little bit. But if you're getting that stiffness in the morning after rest, that's a warning sign that something's not going well. The other thing that you always want to look at is actual back or neck pain, especially if that pain is recurring, keeps coming back, or it lasts for longer than weeks. You should get consulted. The biggest thing to always check out is if you're getting any type of radiating pain, numbness, or tingling into extremities, like coming down to the arms or hands, or down to the leg to the feet. That's always an indicator that you should be seeing a chiropractor getting checked out.
And I'm guessing you do see a lot of patients who come in after maybe moving, lifting heavy objects. I mean, sometimes there's no way around that.
Yeah, of course. You know, and the old adage, everybody knows, lift with your knees, not your back, is totally true, right? Whenever we're lifting something, you always want to try to keep that as close to your center of gravity as you can. The further away you extend it from you, the more it weighs in terms of your low back. And you want to feel the weight of whatever that you're lifting in your legs and your butt. You never want to feel it in your back. That means that you're lifting improperly.
You know, I'm sure people have had, sore backs for, eons and generations, but something relatively newer in maybe the last 15 years is this.
Oh, yeah.
So, the old text neck, what are you seeing with that? Have you, noticed that? Are people coming in saying my neck hurts?
Yeah.
And how do you cure that?
Well, so where we're starting to see it really nowadays is in teenagers, because they're doing a lot of this. We're getting cell phones earlier and earlier. And one of the things we're starting to see on x-rays is the literal horns that are starting to grow off the base of the skull. That's literally the bone being pulled towards the spine as they're doing this over and over and over again. So we do a lot of postural correction in the office. We work with patients on orthotics, which are literally just foam blocks that they can lay on at home in order to bring extension back into the neck. It's the opposite of doing this. Simple exercises can help correct that, but the biggest thing, parents, is to make sure that you're watching your kids doing this, and like your parents were doing, saying, hey, straighten up, make sure you're watching it from the front. We're not doing this constantly.
Look at this, we're growing horns. That's
I know.
evolution.
Yeah, it's crazy.
Don't check and see if we're growing horns.
Yeah, I don't know. I also, my neck got sore.
Yeah.
Okay, so now you also mentioned text neck. Is there anything else like that's kind of come into the zeitgeist in the last few years with technology, or is that the main one?
I mean, that is the main one that we're starting to see in younger kids, but it's not just the cell phones that are doing it. A lot of heavy backpacks that we're seeing nowadays as well can cause postural issues in kids. The earlier you get your kids checked out for this stuff, the better it is, right? Because the earlier we can intervene and change some of this stuff. But just make sure that your kids aren't wearing these super heavy backpacks. They're going to the lockers more frequently. Or I tell patients the easiest thing to do is just get a backpack with a belt on it. So if you wear it around your waist, it's taking pressure off of your shoulders and your neck.
Or a roller, right?
Yeah, rollers are great too. Yeah, that's
because
another
we
new
did
thing.
recently switch to those.
Yep.
Because the backpacks are heavier and heavier.
They're crazy.
So they actually have like a roller bag?
Yeah.
Oh, yeah. Looks like they're headed to
like
the
an airport
airport.
bag.
Jeez,
Yeah.
kids these days
Just
packing
for
a
a
lot of
day.
stuff. I just needed a peanut butter
Work smarter,
sandwich.
not harder.
So is any group more susceptible? Oh, geez, more susceptible to poor back health?
Not necessarily, because everyone's different. I would say that athletes always need to make sure that they're getting checked out because they're the ones that have more external forces being exerted on them, especially the more physical sports like hockey or football or lacrosse. These kids are getting hit. There's a chance that something can go out of alignment or get jammed or stuck. And like I said, the earlier we can intervene or see something like that, the less of a long-term effect that it can have on the patient. So definitely want to get your athletes checked out too.
We might need to petition for standing desks, I'm thinking.
I agree.
Yeah,
It's a long morning to be sitting.
Start that petition.
At least you got good chairs,
See how that works.
I want you to get your comment on this. I mean, a lot of people have kind of, a fear of a chiropractor. Kind of calm them down when they have people are like, I'll never go to chiropractor. They're crunching bones and stuff.
Yeah,
Talk about that.
so that's a great point. The way that we adjust in our office is without manual adjusting. So we actually do use our hands for certain things, but we don't do a lot of twisting or popping or cracking. We actually use an instrument called an activator. There's no popping or cracking with that. It's a very gentle and effective way to get joints moving again without hearing that crunch. We do still do that for the people that enjoy it because it does feel good.
Ooh, but yeah, sound, it gets me every time.
Well, now it's like huge on TikTok, right? I mean, those videos are blowing up.
Yeah. All right, Dr. Jon, thanks a lot for coming in
Yeah,
this morning.
thanks for
Really
having me.
appreciate
We appreciate
that.
it. Good
Appreciate
tips.
it.